All right, hello and good afternoon, everyone, and welcome to our session entitled Social Skills Intervention for Adolescents with Disabilities in Schools, the PEERS program. Our speakers this afternoon are Jane Ann Worlock, Senior Trainer, and Erica Davis, Training Program Coordinator at the Center for Autism and Related Disabilities. I'd also like to thank our closed captioner for being here with us today. And I'd also just like to remind everyone to please complete the evaluation for today's conference. I'll share the link to that in the chat towards the end of the session, and you'll also receive a copy via email. So without further ado, I'll turn it over to our panelists.
Thank you so much, Alyssa. Erica and I are really happy to be here today and to speaking with all of you who are signed in. As Alyssa mentioned, my name is Jane Ann Worlock. I'm a senior trainer at the Center for Autism and Related Disabilities in Albany, New York. We are a research foundation program, and we are affiliated with the University at Albany, the College of Arts and Sciences, and their Department of Psychology. Also with me is my colleague, Erica Davis. Erica is our training program coordinator. As Alyssa mentioned, we are going to be talking to you about the PEERS program. PEERS stands for Program for Education and Enrichment of Relational Skills. And initially, it was developed as a social skills development program for adolescents and their parents. But since the initial development of the program, it has expanded to be a program as well for school-based personnel. We come from the autism world, of course, and our bent, if you will, our focus in using PEERS is to help individuals on the spectrum who have difficulty making and keeping friends. That is the purpose of putting a program like PEERS into place. But it is not autism specific, and so that's why we wanted to share it with all of you. The PEERS program is an evidence-based program for any teens. In our case, it's teens age 12 to 17. Although at times we have extended it to 18 when we have, say, a senior in high school who has an early birthday, but they're still in the high school environment. So it's meant for middle school and high schoolers to learn how to better make and keep friends. And so I'm going to let Erica share with you now our training objectives for this afternoon.
Thanks, Jane Ann. So what we're hoping that you're going to take away from this is really learning more about the structure and the content of this program. We're going to walk you through kind of from start to finish, the basics of the program, along with talking about some of the difficulties and why we're using this program for individuals that are really struggling with social skills. We're also going to take you through kind of a short little glimpse into a school district that we worked with around this population and implementing the PEERS program and some of the positive outcomes that we happen to see from working with the school district and teaching these social skills with the students that they were working with. And then also talk a little bit about really how can you implement this program in the school setting. As Jane Ann mentioned, we actually do this program in our clinic, but it's possible to also provide this program in the school setting. And the great thing, I think, about the manual itself is that you can do it however it fits your school district, your day. Really, you can kind of make it work however it's going to best work for your school district, which is a really nice thing about the program itself.
So, it's probably not a surprise to any of us who work with children who have special needs that many of our children, particularly our teens, as social environments in school and neighborhoods and so on and so forth become more complex as they get older, that they start to have difficulty being able to make and keep friends, being able to socialize effectively and satisfactorily, appropriately with their same age peers. So poor social communication, in the instance of our population, obviously that's one of the core characteristics of their disability, is a deficit in the area of social communication. But we know that they are not the only group of children with special needs, students with special needs that we, that have difficulty with social communication. Some of the individuals who you may be working with and who we work with have difficulty providing relevant information when they're having conversations with individuals. They may make unexpected leaps in topics. They may have an unusual way of speaking, a very pedantic style of speaking or poor speech prosody. And they may have a lot of difficulty interpreting verbal and non-verbal social cues. We see that a lot with our population. That, you know, individuals, my favorite is when you have one of those kids who's talking and talking and talking to you, and you know, you're looking at your watch and you're looking at them and you're backing up a little bit from talking face to face with them, and they still keep talking and they keep walking towards you, and they have no sense, I guess. Hey, Ann Malik is here from Legal Aid. All right, I'm gonna have to say hi to her. But you know, you're looking at your watch and they are just not picking up on the fact that you've got somewhere to go. Time is running out. And so, you know, that could possibly be the case. Shout out to my friend Ann Malik, who works with my husband. Hi, Ann.
Some other things that you might see. So, you know, our population, that poor social awareness could be poor eye contact, as Jane Ann kind of just mentioned, some of those social cues. We kind of call those some hidden curriculum types of difficulties, where you're not explicitly taught certain things, you know, within a classroom setting, but really we just learn them through being able to go out and experience them in the real world, right? Whereas a lot of our individuals that we work with and maybe live with may have some difficulty with that and may need to be explicitly taught those types of things. Poor social motivation, possibly. You know, a lot of the individuals that we work with that have some special needs aren't as involved in social activities, quite possibly. They may not be involved in those extracurricular activities or in clubs or in sports, quite possibly. Poor social cognition. So having difficulty around theory of mind, being able to put themselves in someone else's shoes, being able to be empathetic with other individuals, or realize that others have different thoughts, different beliefs, different ideas than what they're thinking about and what they believe in. And so a lot of these deficits then can relate to some of these consequences that we're seeing with our population. Social neglect and isolation. They may be withdrawn. They may be seen by others as being shy, quite possibly, not engaging socially. And oftentimes, especially with the teen population that we work with, we see a higher rate of anxiety and depression because of this neglect and isolation. Peer rejection can be pretty common. Teasing, bullying. We have a lot of teens that are or have been unsuccessful in their attempts to socially engage with their peers because of these difficulties that they have. Sometimes this can even lead to a bad reputation for our population. Peer conflict, you know, arguments that are resulting in the termination of friendships because maybe the teen or the individual doesn't recognize that, you know what, sometimes you can have a conflict, you can have a disagreement with one of your friends, and that's okay because we have different beliefs, different ideas, different thoughts. But that doesn't have to terminate a friendship. And there's actually a certain way that this program talks about on how to being able to resolve that type of disagreement with your friend. And then the last one that I think Jane Ann had down there is lack of close reciprocal friendships. So a lot of our population have poor friendship quality. You know, if you were to ask someone, you know, and we kind of go through talking with the teens that are going to be a part of the program when we're working with them and talk about, you know, their friendships. Who are you friends with? They may say, you know, Timmy. Okay, well, you know, what do you and Timmy do together? Oh, well, we don't do anything outside of school. Okay, well, then why is Timmy your friend? Well, because his locker has been next to mine, you know, for the past 2 years, or he passes me in the hallway, or, you know what, we happen to have class together. Well, that's not really a very close kind of in-depth, meaningful friendship, or even really a friendship at all. Maybe it's just an acquaintance, but they are looking at those individuals as actually being considered to be their friends. So we talk kind of about the friendship piece of things as well.
Or you can have an opposite situation. Erica, you may remember, I have an adult son now who is on the autism spectrum. But when he was in middle school, he made a friend with a boy who lived a couple of doors down from us, and they went to school together. Even though the boy was in a class grade behind him, they took the same bus, et cetera, et cetera. They had the same lunch period, and he became friends with that boy, which was very exciting for me. You're always happy when you have a child who has a social communication deficit, that, they've found a friend and they've connected with someone, and they started to, hang out a little bit at our house or at his house. Well, the following school year, the parents of this little boy decided to put him in a private school. And, I happened to ask my son, were you thinking of inviting so-and-so over to play video games? No. Well, why not? Well, he's not my friend anymore. Well, what happened? Did you guys have a fight or an argument? Did you do something to him or he do something to you? Well, no, he doesn't go to my school. So, some of our students with disabilities who have special needs, are that concrete about what makes a friend or what doesn't make a friend. Erica was, on one end of the continuum, anybody who smiles or waves at me in the hall is my best buddy, to just the opposite. If you don't go to my school, but you live 2 doors away from me, you can't be my friend because we're not schoolmates anymore. So it can be kind of tricky with some of our populations. Friendship may seem rather superfluous, but there are so many benefits to having a friend or friendship circle. Just having 2 close friends, research has shown predicts better adjustment later on in life. We know that friends, even from our own experiences, our friends often help buffer those very stressful experiences that come up as part of everyday living. You've got a problem, something's happened, you're feeling really stressed, you might pick up the phone or send a text message or somehow get together with a friend and talk about what's been bothering you. I certainly think that, what we've been through with COVID in the last 2 years has probably emphasized how important our social relationships were. It was so difficult to not be able to gather with family and with friends and to be able to share more contact with them. Having friends helps us with our self-esteem. It helps us with our independence. It also correlates very negatively with things like depression and anxiety. When we have people who care for us, who like us, who admire us, who respect us, and who want to spend time with us and share things and experiences with us, that's really good for our emotional well-being, our mental health. And so there's a lot of benefits to having friendships. One of the best benefits we see with a student population is when kids who have friends are less likely to be bullied. We know that friendship and friendship circles are protective factors against bullying from other students. And so that's another good reason why we want to help our students encourage, have these friendships. Not to mention the sort of long, the long view of things, learning to make friendships and develop friendships helps us with learning how to function socially in our workplace. How do we get along with our colleagues and our supervisors and our directors or our principals, our department heads? How do we get along with a significant other, a long-term partner? How do we get along with our neighbors, our landlord, really anybody? So this is sort of, a bit of a practice for what we're called upon to do later in life. And many of the individuals in our particular population, as they grow older, if they have not developed some of these social skills, find that it's very hard to have satisfying long-term relationships and also to gain and retain employment, which is very important.
I think actually, Jeannie, you just mentioned a lot of these things already, which is wonderful. The risk factors for peer rejection, which can lead to teasing and bullying. And those are actually 2 of the topics that we talk about in this specific program. So, being less socially competent, especially, we're talking about the teenage population, but this specific curriculum does actually talk and has a manual for, or is coming out, I think, with a manual for the younger population for preschool age. And there's also one for the adult adult population as well. But, with the teen years, that social competence, things become a lot more complicated, right? The social milieu kind of changes quite a bit in these years. So being less socially competent, not having as many friendships, or not having that peer support group kind of leaves some individuals open more for this peer rejection, which can lead to bullying as well as teasing. And we, as I think Jane Ann just mentioned, actually, friendships are known to protect against victimization. And that's one of the things that we talk about in this program, to be able to, if you are being bullied or if you are being teased, these are some of the things that we talk about, is kind of having that peer network, that peer group around you, to help support you with that.
So some of the consequences that research has shown us, come about as a result of peer rejection and the inability to form at least one or two good friendships as you're growing up, it contributes to more mental health problems, probably most likely depression and anxiety. It can contribute to a greater level of juvenile delinquency. Definitely has an impact on academic performance. It can make going to school and being at school very difficult for individuals, very stressful for individuals, often leading to them dropping out of school, not completing their education. They may turn to substances in order to feel better about their circumstances. And of course, if we're seeing kids who are developing depression because they realize I'm different from other people, I don't seem to be able to do what so many other kids in my class can do to make friends and to keep friends, that depression can become quite severe to the point of, increased suicidal ideation and attempts. So, it may sound like it's kind of superfluous. Oh, friendships, what's so important about that? But these friendships and the ability to at least coexist with your peer group on a neutral or positive level, and not to have to deal with peer rejection, really can have a very important impact on our students' health and mental health.
So as far as social skills training in general, it's very common, right, for children with various disabilities. There's a lot of different types of training that are out there. If it's peer-mediated interventions, we have looked at information from Scott Bellini. He has a social skills program that's out there. Kathleen Ann Quill, from her book, Do Watch, Listen, Say. She also has information for younger individuals around social skills. But what has been found is that a lot of these programs aren't actually for teens and adults with disabilities. They're for the younger age, the elementary age, the preschool age, and working with those individuals. They also, some, don't necessarily use evidence-based curricula. And they also don't look at tailoring things to the cognitive style of those target individuals. So how do they learn best? What is most important when you're teaching them? Instead of just doing the lecture style, making sure that we're having practice, making sure that we're looking at those ecologically valid social skills, that we're telling them what to do, that we're showing them videos, we're having them practice, we have them, do homework assignments as well. That's another big piece, because we know for a lot of, especially the autism population, generalization is difficult. So by coming and learning things either in the school environment or learning it in a clinic or learning it at an office, and just practicing those skills in the office, they may not generalize then to other environments. So it's really important to look at having those homework assignments, so that way they can practice the generalization across environments, across individuals as well. A lot of social skills trainings also don't either include the parents and or the teachers. So it's really nice, if you are a teacher and you're implementing this program or implementing a social skills training, also involving the parents, especially to help with that generalization piece. So that way the parents know what the student or their child is learning and can help support them in other environments. And not all assess the durability of treatment gains over time too. So looking at these things long-term, looking at supporting them over, the course of, many weeks, and then looking at follow-up, months later as well.
So the PEERS curriculum for school-based professionals is an evidence-based intervention. Dr. Lageson, Elizabeth Lageson, who is the creator of this intervention program, this model, has done a tremendous amount of research on the effectiveness and the validity of the peers program. I think Erica and I back in the office probably have a binder about this thick of research articles that were, research projects that were done by Laugesen and her team to look at the effectiveness and the validity of and the reliability of peers. And so if you're interested in, if you're a research junkie and you'd like that copies of that research, let us know, get in touch with us so we can share it with you. But trust us, there is a tremendous amount of research existing now that shows that teacher facilitated peer program was effective. So once they moved from the teens and the parents into developing a school model, they had the same reliability and validity. Overall, teens who go through this program show an improvement in social responsiveness. They show an improvement in being motivated to be social, being more aware of what's going on with them socially, being able to socially communicate more effectively. In terms of our population, and some of you may be working with that population as well, if the person had autism, a lot of their autistic mannerisms reduced as a result of coming through the program. Improved social cognition, so understanding that other people may be thinking or feeling things that are different from you, and having more of an appreciation for that than you did before you came into the program. Hopefully less anxiety, because now they have a better sense of what they should do in social situations. They don't have to worry and wonder, what if someone stops me and talks to me? What if someone wants me to join in a conversation in the cafeteria, or asks me, to do something with them? Hopefully that social anxiety is diminished as a result of having more tools that they've learned in the peers program. And one of the things that we're always looking at is how many get-togethers are they having with kids their own age, either by their invitation or by getting an invitation from others who are in their age group. So more socialization outside of school, either at their request or at the request of a peer. And then greater social engagement, just being involved more with their peers instead of being isolated, and just, go to school, do the academics, come right home, or whatever program they're in. One of the things I can't remember if it specifically says this on one of the slides, because there are quite a few slides in this presentation, but one of the things I probably should say right out front in terms of the structure of the program is, this program is not meant for individuals who have an intellectual disability, as well as autism or ADHD or whatever else they are challenged with. This is an intervention that's meant for children who have at least an average IQ and who have the verbal capacity to have conversations, to do that back and forth, at least, in a rudimentary way. They would probably do it a lot better if they knew some of the conversation rules, if you will, but there's not anything that's preventing them from speaking or having a conversation, other than it may be awkward because they don't really understand the social rules around conversation. Hopefully that makes sense.
Yes,
so
because
I can't remember if that specific detail is in one of the slides, but it is targeted to a particular age group and a particular functioning level, if you will. They have to have some skills to be able to participate in this program. The other thing that's really important is motivation. In this program, you're asking kids who have had probably numerous failed social attempts. And many of them are quite reluctant to do some of the things that they're asked to do in order to learn how to be more socially effective and successful. So if the child isn't motivated, if the child's being dragged to the table to do this, chances are it probably won't work for them. When Erica and I are looking for a cohort of teens to work with, we're looking for kids who at least say, I wish I knew how to stop the teasing. I wish I had one friend. I wish I had somebody to do something with. And so you have to have a way to gauge motivation. Do they have to be jumping up and down, waving their hands, saying, oh, please pick me, I so want to do the peers program? No, but you have to find some little kernel of motivation to work off of with whoever you choose for the program.
Right, Jane. And when we're working with trying to figure out the cohort that we're going to work with, those that are interested, the parents obviously are very interested in the program and they want their child to be a part of the program or their teen. And we recognize that, for 12 to 17-year-olds, sometimes 18-year-olds, that, this isn't going to be something that they're super excited about necessarily, but we have had some teens that are like, you know what, absolutely. I realize that I'm struggling. I would like to have friends. This is something that I want. And some other individuals are like, I'm willing to try. And that's really all that we ask for, because there are certain aspects that you'll see as we go through this program that they need to be able to pair up with another individual in the program, or possibly two individuals. And so it's a lot more helpful if they're willing to at least try, because the other individual then doesn't get stuck kind of by themselves. So we'll kind of break down the program for you right now. This is what the manual looks like. It is a teacher facilitated program. It doesn't have to be, I would say, in the classroom necessarily. We have had some districts that have done it at lunchtime. We've had teachers provide the training. We've had social workers provide the training. It is 16 weeks. So that kind of the entire program takes place over 16 weeks. Each week you focus on a different skill and they kind of build on each other. So like the first week, and you'll see an example in just a couple moments, we might be talking about conversation skills or common interest, or even just friendship in general. The lessons themselves, and this is where you can be a little bit creative depending on what really is going to work within your environment, within your context, within your school district. The way the program is set up right now is for 30 to 60-minute daily lessons. When Jane Ann and I provide the program at our office, it's for 90 minutes. So we do it once a week for 90 minutes. However, we've also had school districts that have decided that they're going to do 45 minutes because that's when their periods are, and they're going to do it 5 days a week. And so this one school in particular that I'm thinking of had like a 10th period or a 9th period that was free for a lot of these individuals and a lot of these teens. And so they did it 5 days a week. And they just had more time to practice these skills. So you can change it up a little bit depending on what's going to make the most sense for your environment. And as you know, it focuses on friendship skills, and there's so many different types of social skills that are kind of going to go into this friendship making piece of it. We do have a section, or the program does, that talks about handling peer rejection, handling peer conflict, handling teasing, handling bullying, because those are really, really important for our population. Included are comprehensive parent handouts each week. So the way that we do it, Jane Ann's actually the facilitator for the parent portion of things, and I co-facilitate with the teens. But for those of you that are working in the school environment, you obviously aren't necessarily going to have the parents there while you're working with their children. So what they have are these very comprehensive parent handouts that go over all the lessons, go over the homework, and really how they can support their teen at home when working on some of these skills. And it's an evidence-based treatment for middle school and high school students, which is the population that we're working with right now.
So the format, the way in which peers is presented, it's a small group format. The group should not be greater than 10 individuals is what's suggested. No smaller than 7, but no greater than 10. It's primarily didactic instruction with some Socratic method questioning that's embedded in it to engage the students. We are looking for parents to assist outside of the school environment, to reinforce, to encourage, and to coach their children to use and practice the skills outside of school. So they become, practice makes perfect. They become better at it. They become more fluent with those skills. It also involves a lot of role playing and modeling. So the teen facilitator, in this case, it would be a teacher or related services professional within a school environment. Or if you're working in an agency, it might be the person's counselor, therapist, could be their caseworker, I suppose. That person is modeling the rules and the guidelines for each social skill that's being worked on. and ample opportunities are given to role play. How do you do this? Through behavioral rehearsal, as well as watching the adults who are facilitating the project role play what they're supposed to be doing. For many of our students with special needs, in particular our students with autism, being able to take the perspective of your friend is a blind spot for many kids. And so part of what's embedded in the process is perspective taking questions. How does a person feel when someone acts this way in their presence? Is it positive or is it negative? And there's we're going to show you a video clip from some of the role plays and behavioral rehearsal materials that are part of the Peers program, where you'll see a little bit of that perspective taking questioning starting right at the beginning of each video. And the teen facilitator, whether it's in school or the program that we do through our office with parents, is trying to help the kids understand another person's perspective in the particular circumstance. Lots of coaching when the kids are practicing these skills. If it's at home, it should be their parents. If it's in the school environment, obviously the facilitators of the program in the school are encouraging the skills that they see being done correctly, the rules being done correctly. And when something is not quite right, they're stepping in the moment and saying, hey, great job doing this, but don't forget, you need to make sure that you follow this rule too, or you need to watch your body space, or you need to not hog the conversation. Whatever the child is struggling with at that moment, that coaching takes place right then and there, so that a correction can be made. And as Erica mentioned, there are homework assignments. Sometimes we call them practice because homework has a dirty is a dirty word to our kids. Oh, no more homework. But there are things that they have to practice after each class so that they become more fluent in that skill.
So as far as, the didactic piece of things, which is really the first piece that we kind of look at and do, we talk about ecologically valid social skills. So these are all the do's. And by ecologically valid, I mean, what actually works in real world settings, not what we think works, but the peers researchers actually went out into the field, talked with teens to try to figure out, okay, within each of these skill sets, what makes sense and what works for them? What do they actually do to increase these social skills? But we also talk about the don'ts. And oftentimes a lot of our teens kind of have that thought of, oh my goodness, you know what, especially when they see the videos, that's something that I do. They usually find them comical. We usually show videos around both of these. There's a lot of don'ts, but then we always make sure that we end with, what are you actually supposed to do? What did such and such do right in this situation when showing the video? So that way we can stop and we can go through, okay, these are all the things that you're supposed to do. So that way they know going out and doing their homework, yes, I'm not supposed to be a conversation hog. I'm not supposed to be an interviewer, but what am I actually supposed to do? So we give them both of those. And we break all of that down into concrete steps, because those are the steps then that they're going to be using in those behavioral rehearsals. We write them down, we keep them on the board. As Jane Ann mentioned, we do a lot of the Socratic kind of questioning with our teens. So giving them the answer ahead of time and then asking them a question about it that they already know the answer to, and breaking those steps down in a very concrete way. So that way they can go ahead and they can practice the skills with their peers and they don't feel so nervous or worried about what they're doing, because they have that information directly in front of them that they can refer to whenever they need.
We also spend some time looking at outcomes, which of course are so important to so many of us working in schools or in agencies, to make sure that what we're trying to do with our students or our families is actually working. And so prior to implementing the Peers program, you should be looking at some kind of assessment. In our case, if we're working to help a school put something into place for a peers program, we would suggest that the teachers who are involved use the social responsiveness scale and the social skills improvement system, which are both standardized assessment tools. And we also send measures out to the parents, whether it's a school-based program or it's the program that's based out of our office. Again, how do the parents see this individual's social skills, the quality of their socialization, and what kind of stress are they feeling as a result of what's going on with their loved one? And then we actually ask the teens to fill out a couple of questionnaires. What do they think of in terms of the quality of their socialization? And what do they know about social skills? Some of the do's and the don'ts. And so we have these measures, filled out before the program starts. And then at the end of the program, we have everyone repeat those measures so that we have some data to look at to see, was there any change between where this young person was at the beginning of things and where they are at the end? How are the teachers viewing this student now? Do they see an improvement in his or her social skills? What are the parents reporting? Are things getting better at home? One of the things I love in facilitating the parent group is hearing, when they come in for the week and we're talking about, did the student practice and did they do all the things that we asked them to do as part of their homework? And sometimes it's 100%, sometimes it's 75 or 80% of it is done. I'm sure those of you who are teaching can recognize homework isn't always done perfectly every time. But sometimes what the parents will say to me is, I know this week my son or my daughter did not do exactly what you asked them to do. And I'm sorry I couldn't get them to do that. But can I just tell you that I'm so thrilled that my son or daughter at the dinner table, who was absolutely silent, couldn't wait to get away from the table and go back up to their room and, be withdrawn from our family, is now actually asking me questions. Now they're actually commenting on things that the rest of the family is talking about. So, sometimes those little things make such a difference in the lives of an individual, either at home or at school.
I have to say, Janie, and that's probably one of the really neat things about the way that we're able to do the program is, we go through homework the beginning of every session. We ask, who was able to have a get together. I know that comes kind of later on in the program, or who was able to make their, their phone call, or who was able to find a common interest maybe with one of their parents. And some of the teens speak up and some don't, and some did it and some don't. But it's not until really we kind of debrief with Janie Ann that we find out that, this teen, this is what he reported to his parents. And we're like, oh my goodness, that's wonderful. He didn't speak up in class at all and say that he did anything. So I think that's one of the nice aspects, is having the parents as the coaches finding out that information, because sometimes our teens don't always tell us, whether or not they did that.
Or even recognize that they did it the right
true.
way, because it's a little bit different than the way we ask them to do it.
Absolutely. That's very true as well. Yes. So as far as getting started with the program, Janie kind of mentioned this already, the composition, of the class, those that have average intelligence, that's really what the program is for. This one's for the individuals between the ages of 12 and 17. It's not specific to autism spectrum disorder. So it's really just individuals that are having difficulty socially. That can be any teen that's interested in being part of the program. As far as required personnel, there is a facilitator, and there's also someone that's usually in the room that's a behavioral coach too, that can kind of make sure that everybody is on the right page. If someone's getting distracted, seeing if they need a break, or if they can kind of redirect them back on task. So we usually do have at least 2 people. We're fortunate enough to have a few more because we have graduate students that work with us. Very minimal materials, a whiteboard. If you are deciding that you wanted to do some of the role plays
Sorry about
That's
that.
okay.
Every time I touch the computer, it advances the slides.
That's okay. If you've decided that you want to do the role plays in person, which is what we've done. So we've taken 2 of our graduate students and they've actually gone ahead and done the role plays. But now, especially I think since COVID has happened, everything is online. So UCLA, the Peers program actually has videos already done. So you can just pull those up if you want. So you would need, a projector and computer and things like that. Another wonderful thing too that the program did since COVID is actually put a lot of it online, virtual. So now they have information about if you wanted to do this program virtual, if you weren't for some reason able to do it in person. The teaching method, Jane Ann mentioned that we use the Socratic kind of questioning. So meaning we're asking questions that we've just actually given them the answer to, so that way they feel confident if they do want to answer. Behavioral management techniques, we use redirection. If they need to take breaks, we have them take breaks. We provide visual supports with examples of what appropriate behavior we're looking for. We may restate the rules because as you'll find out in the very beginning, it's one of the first things that we do is go over the rules. And sometimes for, some of our students, they might need some fidgets. They might need something in their hands to kind of play with. Maybe they use it underneath the table, as long as it's not loud and it's not disrupting, them from learning or their peers from learning. We don't mind if they have some simple little fidget. So that way, hopefully it would make them feel a little bit more comfortable in session. And then the last thing is including parents as coaches. And we've already kind of described why we do this, but it really helps with that generalization piece.
Mm-hmm. So the lessons every week follow the same format. The first day, the first thing, other than the very initial meeting where you haven't had any homework, but once the program gets off the ground, the first day you're just reviewing the practice that they did since the last class. How was the homework? How did it go? Were you able to complete it? Do you think it was successful? What happened? And every student reports out how it went. I do the same thing, because I'm facilitating a parent group. I'm also doing that with the parents too. So it takes about 30, sometimes 45 minutes for everyone to kind of share what their experience is. The second day, a lesson is presented about a particular skill. In the beginning, we're talking about conversation, because that's usually how we start friendships, is we say something to someone and we have a conversation. So Erica rolls out conversation and how do you have successful conversations. And they role play what you do in a conversation, how you keep a conversation going. In day 3, we go over what were those rules for conversation. Why should we not hog a conversation? Why should we stand an arm's length away from someone when we're having a conversation? Why should we position our bodies in a certain way, oriented toward our peer when we're having a conversation? So those kinds of things are reviewed. They get to have more practice with that skill with each other. The facilitator would divide up the group into either dyads or triads to practice those skills while the facilitator and whoever is assisting them is milling around the room and checking to see how kids are following the rules and executing what they're supposed to do and giving them feedback. A lot of times there's some sort of teen activity that's fun and engaging, but also is helping to reinforce whatever that social skill is. And Erica will explain one when she's talking a little bit more specifically about how a particular lesson would go. We give them the homework assignment for the next week, and we give them the handout that they should be bringing home to their friends, which of course, their parents. That could also be sent out electronically to parents if there was some question about whether it would ever get from the backpack or the locker to mom or dad at home. So that could be sent electronically. In the past, schools have just, given it as a handout, and the kids are supposed to give it to their caregiver or their parent, their guardian, whoever is at home with them.
So looking at the setup for week one, which is introduction and trading information. One of the first things that we have them do is have them fill out questions about themselves, answer questions about themselves, and they all answer the same ones, such as, what's your favorite meal? What is your favorite vacation spot? What color are your eyes? What do you like to do on the weekend? So we take a couple minutes and we have them fill out that information. Once they've kind of handed that all in, usually the behavioral coach will kind of take it, we'll cut it all out, put it into the categories, because we'll end up playing Jeopardy a little bit later on with them. We do introductions. You may have students that are from different grade levels, or you may be from a really large district that has a lot of students that, even in the same grade, that they happen to not really know each other. So in our instance, we have individuals from different school districts. So it's usually their name, their age, their grade, and then what school they happen to go to. We start off with rules for the class. And we always make sure that we ask, why is this a good rule to have? So raising your hand. Why is this a good rule to have? Listening to other group members. Why is this a good rule to have? We go over, the overview essentially of peers. What is a peer? Someone else that's your age, a friend, a classmate, a colleague, quite possibly. And then we go over the structure of the lesson. So just as Jan mentioned, we have homework, we go over the lesson itself, you'll practice, you'll play games, and then at the end, and then you'll end with having that parent handout to give to your parents and bring home themselves. With this program, also, each of the students have the ability to earn points. So really, they earn points for anything that they do in a positive manner. They receive points for following the rules. So if they raise their hand to answer a question, they would get a point. If they completed their homework, and really in every aspect of their homework, we give them points. If they answer, any of the questions that we're asking, they get multiple points for those. So if someone had to call Jane Ann that week, we would talk about, okay, well, who called whom? Okay, you get a point for that. The fact that you called. Did you find a common interest? Oh, you did. That's wonderful. You get a point for that. What was the common interest? Or even if you didn't find a common interest, that's okay. But the fact that you're letting us know, you still get a point for it. So participating in lessons, practicing the new skills with one another, when they're paired up, together to go over the conversation skills. And in the first week, they actually kind of ask each other questions that are on the Jeopardy sheets, because we're going to play Jeopardy and they'll earn more points for that. We see that they're engaged and they're trying, so they earn points. We oftentimes give tons of points, especially when it comes to good sportsmanship and playing games. That gets, later on in some of the sessions, they get points for that. But the points are calculated, as an individual, but as a whole group. And so we talk about the more points that everybody has is better for their graduation ceremony, because the last session, we kind of have a party. And we also, go out and buy prizes for them, depending on what we think their interests are, or Jane Ann will touch base with the parents and find out, what is a good game? We make sure that the prizes that we're giving them are also ones that are going to be socially relevant, that aren't something that they can play solely, but are something that they can share with another individual if they were to have a friend over, or even being able to utilize it with their parents or with their siblings at home. So that way they can continue to practice these skills. So it's better, if everybody's earning points, that just makes a bigger party, and a more fun party is usually what we tell them. So every week, everybody has the opportunity to earn tons and tons of points. Then we talk about characteristics of good friendships. What is a good friend? And then we go over also the types of friendships. So we'll talk about, well, what is an acquaintance? And does an acquaintance have all the characteristics of a good friendship? We do a lot of kind of writing this on the board. What is a casual friend versus a regular friend versus a best friend? And do they have all the characteristics of good friendships? So that's kind of, part of session one in a nutshell.
On the second day of the week one of the program is that didactic lesson. So Erica and or whoever is facilitating in a school is going to talk about something that we call trading information. The peers model has a lot of what they call buzzwords, little phrases, little names for what it is that we do socially. that will stick with the kids. So in conversation, really what we are doing is trading information with one another about ourselves and what we like, what we dislike, and so on and so forth. So we help the kids understand that friendship is really based on common interests. You have things in common with one another. And this idea of trading information with people, the reason we talk to one another and have conversations is to find out if this person likes some of the things that we like, wants to do some of the things that we do. Because guess what? If they do, we might be able to do those things together. So there are rules for how you trade information. We show the kids a role play about the inappropriate way you trade information. And then we pull back and say, okay, what did this person do wrong? How is their conversation partner going to feel when they stand too close to them, or they don't give them an opportunity to speak, or they don't talk in a voice that's loud enough to hear, or they talk in a voice that's so loud that it's like, oh, you want to back up, right? So what went wrong? Let's do a little social autopsy, if you will, of what we just saw. And then, as Erica mentioned before, we show them, okay, how do you do it the right way? And then after they see that video or see that role play, if it's done live, then we step back again. All right, what happened this time that was better? What did the person who was trying to improve their social skills, what did they get right? How do you think that made their conversation partner feel? Again, that little perspective taking. Do you think that person might want to have a conversation with them again? If they found a common interest, do you think that they might be interested in doing that with that individual, going for a hike, or shooting hoops out in the basketball court, or taking a bike ride? And so that's pretty much how the didactic lesson goes.
And those perspective taking questions, I think, are really important because, it gives them a time to stop and think and try to put themselves in someone else's shoes that maybe is on the receiving end of someone that's talking too loudly or someone that's constantly interrupting them, because they may not have had that chance to really stop and think about, okay, well, how does that type of behavior affect another individual? And kind of the consequences of, well, would they want to be friends with a person that is constantly interrupting them and not letting them speak? Well, no, probably not. You're right. They probably wouldn't. Okay. So I think that's an important piece of it. Thank you, Janet, for going back. Sorry. That's right. For rules for trading information, I don't have to go through all of these. These are all in the manual, but these are the things that we talk about. So asking the other person about him or herself, their interests, their hobby, what do they like to do as far as weekend activities? And then we usually ask them, why is it important to ask the other person about themselves? Well, you want to know what they're interested in. You want to get to know them a little bit better. Also, the next thing is it's also important to answer your own question. So if I ask Jane Ann what her interests are, what she likes to do on the weekends, and she says that, she likes to go to the park and she loves to go and play with her dog at the park, then maybe I would say, oh, you know what? I actually like to go to the park too. Or, oh, I don't have a dog. I like to go, my children have sporting events on the weekends, or I like to, do something else. I'll answer my own question because that gives Jane Ann information about me, and we can try to figure out if we have any common interests that way. Finding common interests, which is that buzzword. Sharing the conversation is important. These are all the things that we want to do, and then we get into those don't be a conversation hog, and we have a video on what that looks like. Don't be an interviewer. Another video on what that looks like, and why would you not want to be an interviewer? What would be the problem with constantly asking question after question? Don't get too personal at first. And we like to also talk about, it says at first, because once you get to know an individual and another person, and after, a certain amount of time, maybe it's okay to get personal with them, especially once you have established that friendship with them. But at first, just meeting Jane Ann, I'm not going to go ahead and I'm not going to spill, all of my personal things that may be happening in my life, because that's probably too much for Jane Ann. She's probably going to think, oh my goodness, wow,
Ooh,
I need to take
weird.
that step back. I don't need all of that information right away. And assessing their interests. So another piece of this is also, how do you know that they're interested in talking to you? Well, are they looking at you? Are they facing you? Are they nodding? You know, we talk about some of those nonverbal types of cues that let you know that someone is either interested in having a conversation with you, or they're no longer interested or not interested at all and don't want to have that conversation with you. And we, again, show them those things and practice those so that way they're aware of what it looks like in a situation.
So I'm going to show you, hopefully this is going to work well. We're going to show you a YouTube video, and I'm thinking this might be the don't. Oh, darn it. With YouTube, we have to look at the commercial. Okay, here we go.
Oh, actually,
Okay.
Jeannie, you can't see it on our screen. At least
Oh,
I
you
can't see it in mine. No, it's not
Okay,
pulling up.
all right, let me put it back.
You might need to stop
I have to
sharing
stop.
the video
Yep,
and then
I have to
reshare.
stop the share. Oh dear. Let's put this back. Give me just a second, folks.
And if you're actually interested, you can go and you can just Google UCLA Peers Program. And when you go onto that website, you're able to actually go and view all the videos. You don't need to have, you know, a manual. You don't need to have a special code or anything like that to be able to view the videos. All the do's and the don'ts for each session are actually on their website, which is really nice that you can now view them there.
Okay, can you see the video screen now?
Yes, I can, Jean Ann.
Great, here we go.
Did you read the books at all? I read the first one. Okay. Yeah. I read all of the books. So I really, yeah, I don't know.
So, and there you can see the perspective taking questions that the facilitator would be asking the kids. What was that like for the person that Elena was talking about? You know, do you think that Elena is going to want to have another conversation with this individual? So let me.
Sorry to jump in. We've got some feedback from folks that they weren't able to hear the video.
Okay, then you know what, folks, I won't. What I won't do is I won't waste your time showing the next one. But the next one, you know, is the two women that were in that video. And they're basically showing, one is a conversation hog. She's just talking and talking and talking about her perspective on a movie and a book, rather than allowing her conversation partner. I'm sorry that didn't work right. I'm not really sure why it didn't, but let me go back to our PowerPoint slide.
Yeah, I would say if you're interested, they're really great videos. And I have to say, you know, we have had our graduate students go ahead and kind of live role play these, but they get a kick out of watching Alina. Alina is the one that does all of the kind of the don'ts. And then it's kind of nice to actually see her be able to do the skill the right way at the very end. And also, I think having the same person do the skill the wrong way can also be really helpful for them kind of as we go on and stuff. So they do get a kick out of the role plays, which is kind of nice to see.
Okay, so in day 3, the introduction is still on the introduction and trading information. The facilitator would review that lesson. They'd have more opportunities to practice that Jeopardy challenge that Erica mentioned. The challenge being using those Jeopardy questions to talk with each other and have conversation with each other to get to know one another. And then if I'm not mistaken, you actually play the Jeopardy game to see who remembers the most about the conversation partners when the kids were milling around the room and talking to one another. Their homework assignment is to trade information with their parents. They could siblings as well, but you know, a very safe first homework assignment. Go home and see if you can trade information with your parents and see if you can find a common interest you have with them. And that's really all they're asked to do the first time. Just trade information with your parents, see if you can come up with a common interest that the two of you have or the three of you have. They're given the parent handout, and if they've earned any points because they've answered questions, they've done a great role play, they did their homework, et cetera, those are all calculated so everybody knows how many points they earned that day and how many points the group in and of themselves have earned.
This is just an overview of the different sessions that Peers has. So at first, we just went over the conversation skills. We do talk a little bit about electronic communication, and Jean and I were actually just talking, I think earlier today or even yesterday, that this may change a little bit to some of these pieces, especially with all of those social networking, with all of the social media that's out there. When this program first came out, I don't believe that was as prevalent. As you can see, it says IMing instead of DMing, but text messages. We do have the students call each other. And over the course of the last couple of years, teens don't really talk on the phone all that often. What they do is they text or they message each other, or they go on Discord and they have conversations through Discord or, through those kind of platforms. So we have over the years kind of talked about how that's changed a little bit. We talk about how to be safe online because a lot of things that we're doing now, especially since COVID happened, everything's pretty much online. We talk about choosing appropriate friends, and we have them talk about all of the different types or groups of individuals that are in, their schools that they see. We identify them, even those that, may not be the best choice of friends. We kind of even put that up on the board, and we talk about why those wouldn't be the best choices as far as friends go. What would be the problem with being friends with someone that is doing X, Y, or Z? Identifying extracurricular activities. What are you interested in? What group do you think that you would belong to? If you happen to love gaming, well, maybe you could join an extracurricular activity with the gamers or a club with the gamers. How do you identify if someone's a gamer? Well, more than likely, they're probably carrying something around with them, maybe a gaming device. Maybe they're wearing some sort of shirt, from a specific video game that they happen to really enjoy. So we kind of break all of that down too. And it's nice also, I think, for the parents to know what are the different areas that your child is interested in, where they feel as though they might fit in the best with the different groups that we've identified.
So for instance, in one of our sessions a couple of groups ago, we had a young man who very, very quiet, very shy, very bright, very artistically talented, and really enjoyed graphic novels. And he actually was taking an English elective, as he was an upperclassman in high school. He was taking an English elective about graphic novels, and he used the skills that that he was learning in Peers and got his teacher to allow some of them to get together either at a study hall or the last few minutes in class, or form a club. I can't remember whether it became an extracurricular in their school or not, but to form a little group of kids who enjoyed writing and illustrating graphic novels, I guess is the best way to put it. And he found a friend group that way because there were obviously kids who took that elective are kids who are interested in graphic novels, whether they just like them or whether they can actually, have the artistic skill to create them. And maybe if they're not artistic, they still have, the storyline that they would like someone else to artistically, demonstrate.
A couple other sessions that you'll see. Using appropriate use of humor. That's always a very interesting session because a lot of teens might think that they're a joke teller, but they're not paying attention to whether or not their peers actually believe or are laughing along with their jokes possibly. Peer entry into conversations or exit into conversations. We really normalize the fact that for exiting a conversation, we're not even, their parents, their teachers, 50% of the conversations we try to enter, we're rejected from everybody. So we talk about what is the appropriate way to try to enter a conversation? How do you appropriately exit a conversation if you have been rejected and you've never been accepted into the conversation? If they start to have conversation volleys back and forth with you, but then all of a sudden they're no longer talking with you, or if naturally you just need to end the conversation because the bell has rang and you have to go back to school. How to be a good sport, whether or not you're playing card games, video games, you're playing physical sports with another individual. And then we also go over how to be a host during a get-together. So if you have someone over to your house, who gets to pick, the activity that you're going to do? It's not you as the host, it's the friend, because what is the whole point of having a get-together? To make sure that the guest has a good time. And so that's one of the big keys that we have to do. And we have to talk about, we actually role play all of that from the time the friend knocks on the door to come into the house, introducing, giving them a tour of, the house. We kind of do a little bit of a makeshift tour, but, this is where you would go, here's the bathroom. Oh, do you happen to know these other individuals that I have here in my home? We talked about playing a game or playing a video game. Are you still good with that? Do you still want to do that? And so we practice those things, and everybody has a chance to practice the beginning as well as the end of the get together, along with all these other skills.
And then we also go over the peer conflict issues. How do you handle an argument with your friends and still maintain your friendship? Because sometimes we do have differences of opinion. And many, at least in our population that we deal with, in the autistic population, many of our kids are so black and white, so concrete in their thinking that, oh, if I argue with my friend, that's it, it's over. And we don't want that peer group to shrink any more, get any smaller than it already is, How do you handle peer rejection? What should you do if someone is teasing you all the time? What do you do if someone says something to you that's embarrassing? Oh, your breath smells, you have BO, why do you wear such weird clothes? Kids are not always so nice. So how do you deal with that? Sometimes it's a message, if I'm not taking a shower every day, and cleaning myself up or brushing my teeth, maybe people aren't going to want to be my friends. So some of the embarrassing feedback, as much as we don't like to hear it, might be telling us something that we need to know about ourselves. Some of it is just meanness, we know. So how do you handle it? What about a bully, someone who's physically intimidating you? What if people are spreading rumors or gossiping about you? What if this is occurring online? It's cyberbullying. And if kids have gotten some sort of, have built some sort of idea of who you are, giving you a reputation, oh, he's a weirdo, or she's so quiet, she doesn't ever want to be around anyone, that kind of thing. If kids are developing some kind of image or idea of who you are and whether you would be a good friend or not, and you want to change that and you want people to see you differently, how could you go about doing that? And so that's really sort of the peer conflict, peer rejection piece that we go over. And that actually wraps up all the lessons. And we celebrate their completing all of this work with a graduation party and a ceremony, as Erica mentioned right out of the bat, with the point system that they're earning.
There is also, I guess you can consider it maybe a companion book that you can give to the parents. I know Jean Ann does give to her parents at the very end of the sessions, that talks about the friendship skills. It also talks about handling peer rejection, conflict. It has additional information for the teens as well. It goes over a lot of their homework, and it also has the role plays and videos. So the science of making friends is also something that you can give to the parents, so that way the parents can continue these lessons and these skills at home with their teen.
We're almost out of time, so I just want to go really very quickly through this. We did run a pilot in the Capital District area. The Greater Johnstown School District several years ago wanted to do this. They started out with a pilot program that had 5 students with autism in it. They met 3 times a week for 30 minutes. They did a pre and post meeting with parents. It was a special ed teacher who led the group. They did set up a Google Classroom so that there could be additional discussions if necessary. And they actually offered later on the next year, because it was successful, they offered it as an elective for any student in the school that wanted to take it, and they got like a credit for it. And this is some of the outcomes. Now, granted, these are all autism specific because it was data for our agency, but you can see Prior to, there was a greater amount of autism symptomology shown, as far as the teachers and the parents were concerned. It was less after they had completed the program. Problem behaviors that were identified, excuse me, by parents and teachers prior to the start of the program were looked at with the SSIS, the Social Skills Improvement System, and they were less so after the program. Parent stress decreased. Adolescent knowledge about social skills increased. So we want to see situations like this. The social skills, parents and teachers both saw fairly dramatic increases in their student or loved ones' social skills as a result of going through the program. These are some of the resources that are available. I know, we've got maybe 2 or 3 minutes to take questions. So let me just say, if you want some of these resources, if you want to talk to us about them, or if we're not able to answer your question here this afternoon and you do have questions, you can always call or email the Center for Autism and Related Disabilities, and Erica or I will be more than happy to spend some time answering your questions if we can't get to it. This is our contact information.
I just wanted to share. So we always do this program in the fall. We find that, we do recruitment in summertime. We start usually the 2nd or 3rd week, I would say, of the school year. And then we finish, I think probably right about December or so. And we had this one boy in particular that his family just reached out to Jane Ann and myself recently. One of his goals throughout the program was to try to have a friend over and have a get together. And he wasn't successful during the program. But then mom emailed us just last week saying that he was able to get together with a friend. They started it at a very kind of small amount of time at first. And then he worked up to actually having the friend over to his house for 2 hours, I think it was. And so it took a little bit, I think, for him to process some of the information. He had a lot of questions. You could tell that in the session, it took him a little bit longer to process kind of the skill set that we were talking about. But it's really exciting to hear from the parents that, yes, it's a couple months later, but you know what? He was so proud of himself that he had a successful get together with a friend for 2 hours, which I think is really wonderful and really big. So those are the kinds of things that we really look forward to hearing about from the families.
I see in the chat box that the most recent question was, Patricia asked us if we've tried the program with higher functioning individuals who have Down syndrome. We, of course, have not, because we work only exclusively with an autistic population. I have not seen anything from Dr. Laugeson's materials that she has done it with individuals with Down syndrome, but she has in her training said, you can go slower for people who need more time to acclimate to the information and to integrate it into, their understanding. You can use visuals, you can use simpler language. That is a possibility. Whether they've done any research around whether that's evidence-based or not, I'm not quite sure. It's not something that we've done, but she has mentioned going a little bit slower in the program to try and see if you can help individuals who don't meet that criteria of average IQ or greater, the verbal skills, et cetera, et cetera. Your students better than we do, or your clients, consumers, your family members. If you think this is something that the group that you work with could handle, you might want to try it or modify it a little bit. Hopefully that answered your question. Any other questions? I know we got maybe 30 seconds left.
We had
Maybe
one more that I think will be really quick and easy to answer. Someone asked about the cost to participate in the program.
Oh, yes. The cost for us, we're a grant funded program, so there is no cost to families at all. Now, depending on where you live, we know that NYU also provides this program, and there is a cost. for that. So, but if you are in the Capital District and you are interested in, participating, or have someone that you think might be interested in participating that kind of meets the average IQ, no, they do have to have an autism spectrum disorder to work with us. But yeah, it's no cost at all. It's just essentially time, being able to bring your child to our offices.
The transition program,
Yes.
the Transitions USA out in, Mayfield, that's run by Lexington Center. They have had a peers program in the past, and they do charge for that. Also, I know Freedom Psychological Services, Freedom First Psychological Services in Latham, often does a group like this or something that's quite similar, and I'm sure that there's a cost to that. Some of you may be familiar, those of you who work with autistic children might be familiar with St. Rose's Friday Nights social skills group. Dr. DeLuke, who runs that program, does have an offshoot that is a sort of a peers hybrid for teens. I don't know if she charges for that, but my guess is she probably charges a nominal fee, not anything exorbitant. As Erica said, we're fortunate in that we have a grant to cover this, for us, so we can offer it to families who have autistic teens who are appropriate for the program. We can offer it at no cost, which is wonderful.
You can also, someone just asked about Putnam County. You can actually go on to the peers website, and there's a button somewhere on their website to be able to type in where you live or the area that you live to see if there's certified professionals that can provide the training. You don't have to be certified. Janie and I did work with Dr. Logison, so we are both certified. Dr. DeLuke also did the same, but you can just pick up the manual as well and provide the training, because it's a very comprehensive manual. But I would suggest, if you are looking to see if there's anybody that's offering the program around you, to go onto their website and to type in your location.
Yeah, the manuals are available on Amazon, and really any place you would buy books. You could purchase the manual. And as Erica said, it's like a cookbook. It is so turnkey, very, very easy to implement. And, it's up to you, I guess, how much you charge for this based on, your resources as an agency or a school district, et cetera, et cetera. But it's a wonderful program with great outcomes for teens who have difficulties making and keeping friends.
All right, well, with that, we've reached our time, so we'll end things there. But thank you so much to our presenters for this informative presentation this afternoon, and to our captioner, and for all of you for attending as well.